Hi, this is Dr. Tim Conley at the Wurzweiler School at Yeshiva University. I'm going to rely on Joseph Walsh's book, Theories of Direct Social Work Practice, second edition, and talk a little bit about the common characteristics of effective interventions, or what could be called common curative factors. One is that the client enters into an emotionally charged, confiding relationship with a practitioner and perceives that the practitioner is competent and caring. This relationship is an antidote to alienation. It enhances the client's morale, and it promotes their sense of self-determination, their determination, their ability to persist in the face of difficulty. So we're creating a relationship where we care about the client, where we are using our skills of empathy, probing, asking open-ended questions, and listening authentically to what the client has to say. It's emotionally charged. They're confiding in us, perhaps telling us things that they wouldn't to other people. This can be a characteristic of an effective intervention, regardless of what method we're going to use, whether it's cognitive behavioral therapy or 12-step facilitation, other therapies that we're going to apply. This is a basis for it. Interventions are based on an understandable rationale and procedures that include, and here's the key piece, optimistic view of human nature. What are we as social workers? We have optimistic views of human nature. We believe that people can heal and change and will heal and change, and we communicate that to the client. The practitioner's expectations should be compatible with the client's view of the world. We want to enter into their worldview and empower them where they are, not try to bring them to a different world. The interventions require the active participation of the practitioner and the client. It's a partnership. It's not us doing it to them. It's them working with us. It's active participation on both parts, both of whom believe them to be valid means of restoring health or improving function. Clients giving new opportunities. So those are some of the common curative factors. Be authentic, be present, be interested in the client, listen more than you talk, elicit a problem statement from them so that they're framing the problem in their own terms. Don't try to reframe and say, no, what the real problem is this. Basically, go with where the client's at, and then we can, begin either motivational interviewing or, developing change talk, developing a discrepancy between what they have and what they want to get, etc. So I started putting this together in response to a student question: can psychodynamic therapy be effective with a person with addiction if they ultimately decide not to go for intervention or for an inpatient? Is it futile as long as he remains addicted to the substances? Very hard to work with somebody who is actually under the influence when they're in the session with you. Not a lot that can be done there, although to some degree, there's benefit in the relationship. It's you're building context, saying, I'm here for you. I'm not going to empower you or, suggest that it's a great idea that you're destroying your life with chemicals. But, I'm here. The door is open. Most people, if they're going to remain actively committed to using, they have no basic motivation for change. They have no, what the 12-step programs would call, the only requirement for membership is a desire to stop drinking. Kind of it's required if you're going to go into somebody to try to change your life, that you kind of want to change your life to some degree. So give people a long rope. Establish and maintain relational context, keep them coming in, continue to practice good basic social work skills, and these common curative factors will have an effect regardless of what model of practice we're going to use.